On February 15, 2013, 9-year-old Ella Adukasi-Deborah passed away after a severe asthma attack. For years, traffic fumes from the busy streets of southeast London had quietly damaged her lungs. Ella became the first person in the world to have air pollution officially listed as a cause of death on her death certificate. Unfortunately, Ella's story is just one of many. Around the world, air pollution continues to harm millions. In this video, we'll learn about various air pollutants and what effects they have on human health. Chapter 1: Air Pollution and Our Health. Air pollution, both outdoors and indoors, is one of the world's biggest health threats. Children, older adults, and people with lung conditions are most vulnerable. It can affect nearly every part of the body and increase the risk of serious illnesses like heart disease, strokes, cancer, and diabetes. In total, it causes around 8 million premature deaths every year. This rivals smoking and is more than 6 times the number caused by road accidents. The burden of air pollution is often greater in low and middle-income countries. In low-income regions, indoor air pollution is high because many households rely on solid fuels like wood or charcoal for cooking and heating. As countries industrialize and move to middle-income status, outdoor air pollution often increases due to growing traffic, industry, and energy use. Chapter 2: Outdoor Pollutants. Outdoor air pollution is worst in cities and industrial areas, where cars, factories, and power plants release harmful gases like nitrogen oxides, sulfur dioxide, and carbon monoxide. We'll focus on 2 particularly dangerous ones: ozone and particulate matter, or PM. High up in the atmosphere, about 15 to 35 kilometers above us, there's a layer of ozone that shields us from dangerous UV rays. But at ground level, it's a harmful secondary pollutant formed when sunlight reacts with pollutants from vehicles and factories. Breathing ground-level ozone can cause burning and itchy eyes, coughing, a sore or scratchy throat, and difficulty breathing. It can also inflame and damage our airways and lungs, which makes them more susceptible to infection. Ozone can worsen lung diseases such as emphysema, chronic bronchitis, and asthma. Observational studies have shown that days with high ozone levels are associated with increased hospital visits. Unlike ozone gas, particulate matter, or PM, isn't just one singular pollutant. These particulates come from burning fuels like gasoline, oil, and wood, and from sources like vehicle exhaust, industrial activity, and wildfires. PM is measured by the size of its particles. For example, PM10 refers to particles smaller than 10 microns across. PM2.5 refers to even finer particles, just 2.5 microns or smaller. That's about 1/30th the width of a human hair. Because they're so small, PM2.5 particles can get deep into the lungs and even enter the bloodstream. This can lead to respiratory infections like pneumonia, worsened asthma and bronchitis, and higher risk of lung cancer, heart disease, and stroke. And it's not just outdoors. Indoor pollution from cooking fires and smoking can also produce PM2.5. Let's take a closer look at indoor air pollution and how it affects our health every day. Chapter 3: Indoor Pollutants. We spend 90% of our time indoors, but indoor air can be more polluted than outside. Indoor air pollutants can come from natural sources, human-made sources, and combustion. Let's look at the common indoor pollutants and what they do. Carbon monoxide is a colorless, odorless gas from faulty stoves or heaters. It's known as an asphyxiant because it interferes with the body's ability to transport oxygen. It binds to hemoglobin in red blood cells and blocks oxygen from reaching the body's organs. It can cause headaches, dizziness, or in high doses, death, especially during sleep. Sources of indoor particulate matter include cigarette smoke, dust, mold, and pet dander. Burning solid fuels like wood, charcoal, or kerosene in poorly ventilated homes is another major source. Asbestos, found in old insulation, pipes, and roofing, is also hazardous. When disturbed, it releases sharp fibers that can cause mesothelioma, a deadly form of lung cancer. Volatile organic compounds, or VOCs, are released by glues, paints, cleaning products, and furniture. One common VOC is formaldehyde in pressed wood and new carpeting, which can irritate the eyes, cause breathing problems, and possibly increase cancer risk over time. Finally, radon is a naturally occurring radioactive gas released from the decay of uranium in rocks and soil. It can enter homes through basements or cracks in walls and foundations. Long-term exposure to radon is the second leading cause of lung cancer in the US. Chapter 4. What can be done? To protect ourselves, we need to reduce pollution and limit exposure. Cities can expand public transport and switch to clean energy to cut smog, and you can help by advocating for these changes with local officials and community organizations. At home, we can improve ventilation, use air quality detectors, switch from burning fuels to electric appliances, and choose low VOC products. Air pollution, both outdoors and indoors, can harm our lungs, heart, and overall health. By learning about the sources and effects of these pollutants, we can make smarter choices for ourselves and our communities. Cleaner air means longer, healthier lives for everyone.